Happy Friday, everybody. Dr. Aimee Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick, Emergency Medicine.
Yes, we're looking all fresh in our scrubs today. You got a shift today. I'm doing some home visits to get out the flu shots, so.
We got an outside dinner date tonight.
Oh, nice. Very nice. It's October. It is, among many seasons, it's also open enrollment season. And what we wanted to spend a few minutes on today specifically is this kind of the time of year people are looking at their benefits available through their insurer or maybe not, or their employer or not. How to kind of, realign. Maybe they can save some money. Maybe they want to go with a different plan. Maybe the plan options have changed. And Dr. Brian and I are both very passionate about the way we use insurance in this country and how perverted it's become with health insurance, how we have just distorted it as the only payment model for all things primary care specifically, which has jacked up the premiums year to year. He is going to take it away and mansplain to us how that works. It's okay. No, he doesn't get to mansplain in my house. No. But go ahead, Dr. Brian.
Right, so let's talk insurance real quick, okay? Don't turn off your TVs or your devices, whatever you're watching this on, because this is important. So insurance is used to manage risk for big items, okay? No matter what we're talking about, whether it's health insurance, car insurance, or homeowners insurance. But let's use this as an example. Mm-hmm. You have a car and you have car insurance, and you get dinged from somebody who backed up into your bumper. And you have this little thing and you want to get it fixed. Most people will say, gosh, don't put that through my car insurance. It's going to raise my rates. I'll just pay for that with cash. So I go into the dealer or I go into my mechanic and they say it'll be $100 to fix that. Mm-hmm. Okay, great. Pay you my $100, you fix it, we go on, insurance is never involved. Homeowners insurance, we had a flood in our second house that was massive. In the flood from underneath the slab in our bathroom, they were gonna have to replumb through the ceiling. It was a over $30,000 job. That's a big deal, and we weren't gonna pay for that out of pocket, so we used our homeowners insurance for that. It was a big thing. So big things we use insurance to fix and to manage the risk. Small things we should try to avoid insurance and just pay for them out of pocket. But what happened in America, and this was years ago when the insurance companies started getting bigger, was that we started looking at health insurance as a payment method, not as insurance. Mm-hmm. So now when somebody goes into the doctor, they just say, yeah, just run it through my insurance. I have a $10 CBC. Oh, just bill my insurance. Mm-hmm. I have this thing to get done or that thing to get done. Oh yeah, just bill my insurance. And we're not looking to pay out of pocket or pay for cash. And that's just this culture and this mentality that we've developed. The problem with that is that it becomes very expensive. Now everything is run through your health insurance as opposed to being paid out of pocket, and the rates go way up. And we're all surprised as why is healthcare so expensive in the United States? Why are insurance companies charging these premiums that are so high? It's because we use it for everything. Mm-hmm.
Even the little things, even the inexpensive
Even
things.
the little things, and we have to stop.
Mostly they use little things, yeah.
What we should be using our health insurance for is the 5-day intensive care unit stay. You get hit by a car and you end up intubated in the ICU, getting $1 million bill that you can't pay out of pocket. That is what insurance should be used for. Or the
cancer diagnosis for the expensive chemotherapeutic drugs.
Absolutely.
Right.
And we think you should have insurance for that, absolutely. But for primary care, which is very inexpensive compared to everything else, let's just pay cash. Let's not use insurance. For those rates that you got for cash pay for radiology and laboratory studies, just pay cash. Don't run it through your insurance because you're going to save the money in the long run.
Right, absolutely. With cash lab prices, direct primary care aims to also make cash lab prices available and wholesale medications available. So even for my insured patients, it's usually cheaper just to pay out of pocket for those.
Absolutely. So before you sign up or before you renew your open enrollment this year, if you have an open enrollment with your company, take a step back, look at it, and say, what is the best option for me and my family? If you want to get some help, talk to Dr. Ostick at Health and Healing Direct Primary Care, and we can help you manage through that, because most people will save money if they go with some sort of high deductible health plan with an HSA, a health savings account associated with it, that has a little bit of a higher deductible, which is okay because you're trying to manage the big things anyway.
Right.
and then you sign up with direct primary care, you'll probably save money overall when you look
Annually, for
when you
sure.
look at the annual costs, and you'll have access to Dr. Ostick and get better primary care than you've ever had.
Right. Absolutely. But we do need to get away from this insurance game, because what has happened then is now the premiums are so expensive that insurance becomes inaccessible. And we talk about, we have, 30% of our U.S. population's uninsured. And just because you're insured doesn't always mean that you have good access to good health care. And
No,
that isn't, and
definitely not.
so insurance doesn't mean access. Insurance certainly doesn't always mean that it's the costliest way or the most cost-effective way to access healthcare as well. So it's a paradigm shift, and we would love to go into more detail about how direct primary care is trying to revolutionize the way that we access primary care and pay for primary care. 60 to 75% of most primary care offices overhead goes to just billing insurance. So when you take that element away, all of a sudden now our operation becomes really affordable and really accessible to patients in the community. So we're here for you, all things medical. We also love talking about the financial piece and the healthcare piece, insurance piece. So if you have questions about your plan specifically, please reach out. 818-600-2426, healthandhealingdpc.com. Thank you, Dr. Brian.
Thanks, Dr. Aimee.
And have a great weekend.
See you tonight at our date.
Okay.